Situations where patients have complex fractures or dislocations, typically it's often handled immediately when they're in the hospital setting, oftentimes by the emergency room, or they go to surgery and they're hospitalized for a while, depending on how extensive the injury is. So a common scenario that we run into is someone has a very extensive neck or back fracture from their high-impact car accident. They get severe, extensive fractures that need to be stabilized immediately in the emergency room. Commonly what ends up happening is that they get the surgery, then they're in weeks and weeks of therapy, whether it's in the hospital or after the hospitalization. They're in several weeks of therapy to get pain under control and their mobility back. But because of how high impact that collision was and how severe their injuries was from the accident, oftentimes these folks have pain that lasts months, maybe a year and a half out. And by the time we receive them, we see their records, we see that they've had all the surgery, they've had therapy. Let's take care of the pain in a more aggressive manner. Typically that's doing injections. Here at our office, we see these quite frequently, and we get their pain under control quite frequently as well with these injections.